Hi dear friends, let us see a maladaptive behavior, which is very important. You would have seen in different developmental disabilities like intellectual disability, autism spectrum disorder, where they behave differently, and sometimes you fail to modify that behavior. So let us understand first what is maladaptive behavior, and I'm sure I will be uploading the behavior modification techniques, which at least it will help you in the your teaching. So today I'm going to talk about the meaning, definition and types. So we are going to understand all these three factors one by one. Understand the meaning of maladaptive behavior. So the term maladaptive adds the prefix mal to a word adaptive, which together we call maladaptive. Okay, so the prefix mal directly translates the meaning bad or evil, and the word adaptive means adjust, modify, alter. So psychological or psychologist has constructed that surrounding a maladaptive behavior do not quantifies the evil behavior. So the term maladaptive behavior is used to describe that adapts, modifies or adjusts poorly. That means the child is not behaving properly because he is not adjusted with the good behavior, he is not surrounded with the good behavior, he is not able to control his anger, anxiety. So because he is not adjusted, because he is adjusted poorly, because he has modified his learning not up to the mark. So that is our maladaptive behavior, which is very easy to understand. Now let us move to the definition and try to understand what is maladaptive behavior. See, here is any form of behavior that is designed to respond, react or adapt to a situation, but is unable to do so effectively. That means that is your maladaptive behavior. See, the child has to sit properly, the child has to talk properly, the child has to respond properly, but it doesn't do that in the situation. That is called your maladaptive behavior. Okay, like angry, whenever you ask something he will be very angry. Okay, and shouting every time, throwing things like this. So which is which can tell you that this is examples of maladaptive behavior. You would have seen number of times with the kids, even the children with developmental delay. Let's understand the several types of maladaptive behaviors, which can be range from minor impairment to the severe impairment. Minor impairment like nail biting and separation difficulties can be a minor or simple maladaptive behaviors rather harming himself. So let us understand few maladaptive behaviors. Okay, so passive communication. See, because you prefer to avoid the argumentative situations or confrontation, you may minimize your feeling or choose not to discuss the things that are bothering you. So this can worse your social anxiety, because without making your feeling known, your needs can be your needs can go ignored, or it will be ignored. So in this way the passive communication can leave one feeling. Okay, so your social anxiety will become bad. So make sure that you be assertive. Okay, don't be passive. If you are passive, you cannot go further. And then avoidance. See, if your social anxiety, you may try to avoid the triggering situation. See, by engaging in the following behaviors like refusing to give a speech in the public, like a turning down event invitation affecting your grades, then backing out of engagement at the last minutes, not talking or not taking the classes that involve the public speaking, eating alone, or limiting what you eat in the front of others, not asking the question in the class, turning down the promotion at work, limiting your social circle, making you feel more lonely. Yes, can be maladaptive of avoidance. Restricting advancement in your career, that is also one kind of avoiding. No, I don't like. So placing restriction on where you go and what you do, which is very important, which you need to take care. Anger is also a maladaptive behavior. Okay, so some child with social anxiety may become angry. Okay, you have seen. So they may be frustrated, temper tantrum with themselves, or upset at other for forcing them to engage in the social situation or ignoring their needs. So this feeling can become a patent up and finally express as anger. So anger is also a kind of maladaptive behavior which child will throw everything. So child vent his or her anger in an unhealthy, that means the child will allow her anger in an unhealthy way, or lash out, which he loves one, he don't, sometimes even we do that, we don't care, we don't respect suddenly when we are angry, so which makes the child feeling guilty afterwards. So and actually makes the child's social anxiety worse. If child is more angry, he will be not able to mingle with the society or the social group. So that's where you need to think over and understand, find out the you need to be very calm when the child is angry. Don't give temper tantrum to the child. So understand the child's behavior. If that behavior is not happening, reinforce the child, and still if it is not controllable, then you do or refer the medical for the medical evaluation. Then substance use. Yes, if the child live with social anxiety and must do something that scares adult child, such as giving presentation at work, adult child may be attempt to treat his or her anxiety with alcohol or drugs to calm your nerves. So most of the time you can see the child, adult child will take the alcohol or drugs in the when the child is in secondary, normally inclusive education or regular education, the child is studying in 12th grade. Okay, so the adult child with anxiety disorder are 2 or 3 times more likely to abuse alcohol or medication than other child. Okay, so like this, the child will be addicted to the substance use, which is harmful to the child. Then self-harm. You have seen number of times where the autism children were the intellectual disabled, they harm himself deliberately. So it is direct, and destructions of the body tissue without suicidal intention and for purposes not socially sanctioned. So this is where the self-harming you can see with the intellectual disability, which you need to take care. So it is used to known as a deliberate self-harm, which is called DSH, but the terminology has become more neutral to remove an implication of blame. So by far the most common form of self-harming is skin cutting. I think you have seen that. Yes, but people can also overdose, burn themselves, cause themselves physical trauma, scratch themselves, pull their hair and interfere with healing wound, and so on. There are a lot of other self-harming, banging the head, biting his hand. So there are a lot of other things which you can see the self-harmingness. Here we are not going to talk about the intervention part, which I am going to talk later. This is just to understand what are the maladaptive behaviors. And self-harm can be a spontaneous or planned. It can be a regular occurrence or one of the time or sometime. Disorder eating, as you see that guy is not leaving the food, he is going on eating. So disorder eating should be differentiated from an eating disorder. Disorder eating refers to the range of abnormal eating behavior, including the binge eating. The pic which you can see here, that is called binge eating, excessive dieting. Okay, so that is your disorder eating. And then what is eating disorder? See, when the level of severity of one or more of this behavior becomes enough to form a diagnosis, it considered as eating disorder. Okay, this is very simple to understand. Then finally, what I want to say is maladaptive behavior often form as a method of coping with certain situations. So everyone will develop that preferred method of coping with different situations. So the problem arises when this method ends up being harmful to child's well-being. So remember always. And maladaptive behavior are typically unproductive and harmful, but the degree and the severity of these behaviors vary widely. So make sure that whenever you see such maladaptive behavior, if you're not able to control, please refer for the medical evaluation. So I think you have the gist of understanding about maladaptive behavior, which we are going to talk in detail in other videos as well. Okay, till then, bye bye.